is we're going to do the lower limb splints. Now for the purposes of both showing you how it fits into the whole scenario, but also to give you as much time as possible to do this, what we're going to do is I'm going to speed through both the primary and the secondary, just so we can get to the piece that's new so you can see how it looks.
So this guy's non-RTC?
Yes. Okay, so what we have here is this guy is walking along, he's walking backwards, his foot goes into a hole and he falls back. And when he falls back, there's a root right here, and so when he falls back, this snaps, it bursts right here. So when we, and he's fallen of course and hit his head, so when we approach we see right where this tape is, we see a small spot of blood on the legs. The leg has a little bit of angulation to it. He's screaming in pain. The scene safe one patient, and the fall was literally from standing, whack, and just hit his head. Okay? So I approach, I've got all my stuff, I've got my ETV, scene safe one patient. And all right, Crush, stay for first aid, don't move, I am here to help. Oh, it's fine. All right, so I'm going to get my hands nice under your head. I'm going to align your head, let me know if there's any pain at all. And helper, come on in here and take over, and that's right here. Okay, Crash. So what we're going to do is I'm just going to check you out. Breathing is 20 effective. Radial pulse is present. Skin is normal warm. I'm just going to run my hands over you. Let me know if you've got any pain anywhere else. In the back and the chest. Lower back and abdomen. Hips. And then this leg here. Oh, serious amounts of pain. Okay, I'm going to get in here. Hold this. Help her get in here and mimic me and hold it. There we go. 1, 2. And then you can feel this below here, Crash. He says yes. How about this leg? Any pain, numbness, or tingling over here? And he says nope. And same thing, arms, any pain, numbness, and tingling, and nope. Okay, so what we're going to do here, Crash, is I'm going to cover you up in a blanket, be able to watch you, make you feel better, and then we're going to get into checking that leg out. So oxygen is on. And so now we do our vitals, our history, and then our head to toe. And again, our head to toe is really pointed, checking out everything as we go along, asking, asking, asking. And then once I get down to the legs, okay, Crash, I'm just going to really check this leg out here. Checking out the knee, because I'm worried if that's broken that something's gone on with the knee. And everything's okay in there. All right, so Crash, I'm just going to cut the pants here and take a peek at it. So we expose, and then we get this. So we've got an obvious compound fracture to the anterior surface of the leg. So all right, Crash, I'm just going to check down a little bit lower here and see what I find. Radial pulse is present. Can you wiggle those toes for me? He can. And when I ask him which one I touch, he tells me it's the pinky. All right, Crash, I'm just going to put a piece of gauze over top of this just as we move on. Check out this leg, pulse, motor, sensory, and then a comparison. Check out both of these arms, pulse, motor, sensory, and then a comparison. Now we've done our full head to toe. I'm going to record my findings that we have a compound fracture, anterior surface, mid-third, tibia, fibula, left leg. Okay? So now we move on to our treatments. And again, I'm doing my ABCs every 5 and my vitals every 10. Other way around. So ABCs are every 10 and vitals every 30. Okay? All right. So now we're into our treatment. So we do our C-BIS. Okay? So C is C-spine rule out. Right? I've got an injury down here. Nothing on my head to toe. Found anything that says there's any other problems. I'm going to take over from my helper. All right, Crash, I'm just going to move your head here. Let me know if there's any pain at all. And there's none. I'm going to go the other way. Let me know if there's any pain at all. And there's none. Okay, I want you to pin your chin to your chest. And again, he doesn't do it very well, but he tilts it down and there's no pain. Push your chin to the ceiling. He does that and there's no pain. Okay, awesome. So we've done that piece. All right, so what I'm going to do here is helper's down there holding. I'm just going to sit you up here, Crash. Let me know if there's any pain when we do this. So he sits upright. And there's no pain when he does that. I check out the spine, check out the shoulders and the back. There's no other problems here. Okay, so C-spine is ruled out. So now we've got C is done. Now I go on to B, which is bandage, which is we have an open wound. So I want to deal with this. So my helper is holding. Okay, so they are holding. We grab a loop tie. body hollow. Now when I do this, I want to be thinking ahead in that I'm going to have two splints in here. And so I don't want the knots where the splints are going to go, which is unfortunate because of course my injury is up on the top. So, and if I needed to, and which I would in this scenario, is I'm going to put more than one triangular on here. For our demo, we're just going to cheat a little bit for speed. Okay, and then this just gets pulled just really loosely on top just to hold it. And then my knot is not going to be where the splints go. Okay, so C is done, B is done, I. Let's get a little ice on here. Okay, and so then we're into splints, slings, and boards. Okay, so my splints, I'm going to get two of these. Again, helper's still here. One is going to go in here and one's going to go on the outside. And because I know that's where they go, I'm going to get my ties set up first, or my triangulars. Okay, so we want one down here at the ankle. Ideally one below the break if possible. And above the break. So this time we go under the knee. And the pants would all be cut off at this point, of course. Never do that movement with the leg. Here we're going to go one on the knee.
On the knee or above the knee?
On.
Okay.
Okay. General rule to go with is when you're putting your ties in, when you put your triangulars in, you don't want to be able to touch anywhere once they're tied, like this, and not hit two triangular bandages. That's kind of a good goal to go with. There is a minimum number of triangulars that we want, but you know, if you've got a short leg, you may not be able to get, or I mean, it may not be as necessary to have as many, or you got my leg, and you're going to have to use, 3 people's kits. So.
You want one above and below the injury.
So I think of it, I want 2 on the long bones, and I want 1 for each of the joints.
2 on each
1, 2,
one bone.
3,
Yeah.
4, 5, 6. So that's my goal. Okay. So probably about this time we're going to be doing an ABC reassessment, okay, and making sure all that's okay. And then we place these guys in here, and this one over here. Now, if we have that slight angulation to the limb, so it's nothing excessive, it's still going to fit in splints or on the board, we would be taking packing, okay, and let's say that the limb bent kind of like this, okay? So I would be packing in here so that the splint would fit, and then I would be packing here and here. Okay, so you got a lot of packing to put in there to hold that leg in whatever position you find it, okay? If it's, no, I mean this is excessive of course, if it was like this is not going to fit in my basket, and so then we would be doing some gentle alignment to anatomical so we can get them in there. Okay, so we've got our splints in place. Now I'm going to tie. So we started at the hip.
Which is the most stable, right?
Exactly. Okay. Actually, do you want to come on here, Brian, for just a second so you can help me out? All I want you to do is just kind of, so we got a helper in here, this is another helper, you just want to hold these so they don't twist on you when I take. Okay, so we do top And then I come down to secure them so they don't flop all over the place like we have Brian assisting with. I know that's right. Someone knew he was doing it. Yeah. Okay. And then we go back up here and we work down pretty much.
So you start at top and then the bottom.
Because otherwise, if you're tying the top,
Yeah.
they kind of, like what happened when I tied it, right? They twisted, they want to move. So we have somebody hold it, then we tie this. I have him stay here just because it helps out. But this holds it together as I pull all the rest. Yeah. And again, you'd be being incredibly gentle and loving with all of this.
Tough to do when somebody's screaming at you, Dave?
What's that?
Is it tough to do when somebody's screaming at you?
It's a medical mallet. No, yeah, it's brutal. And like I say, you're being super, super careful with all of this. Super gentle with your ties. You got helpers holding everything.
And yet you want to crank those nice and secure.
Yeah, and you know what? It's, you know, like that fellow that I had with the hand that was crushed. As soon as you get it all splinted, they tend to feel, okay, things are okay. All right, so that's still on there. And then this one, you don't want it to cover over your knot for your loop tie, so you still have access to that injury. And in 10 minutes from the ice being put on, you want to take that off. Okay. So, you've got nothing here, nothing here, nothing here. And then this one here, you're kind of going, all right, this maybe needs another one. So, we may be using our bandage pull to slide another tie in just right on top here so that we can't, that's too big for me.
Yeah.
Okay? Does that make sense? Where like here, I hit 2 triangulars, 2 triangulars, 2 triangulars. Down here, totally 2 triangulars. But in here, it's a little bit big. And that's a problem with your injury because you don't want to cover over your knots.
That's right.
Okay?
Or the injury.
Or the injury, so you've got access to it. But like I say, my triangular is really right here. This is where the injury is. I could totally get another one kind of slid into there. Okay? So, now I've got the splint tied on. Now my job is to make sure that I didn't mess anything up when I put it on. So now it's pulse is still present, doing a comparison between the two, and keeping track of my times for my ABCs, my vitals, and the old ice. Okay? Question?
This flappy piece of bone on top, you know, you're putting these triangulars and whatnot.
Just gentle.
Just support, and you're stuck. If that moves, it moves. And that's going to get moved. Can you do that?
Yeah. I've been looking at it to see which way I can twist it.
Yeah. Great. Okay, thanks.
Apologize to cover old